Pharmacognosy is one of those courses in pharm school that proved to be a bit challenging. And then it's not really because the content is hard. The content is quite easy and fairly interesting. It proves to be a bit bulky, especially when you let the work compile. And so my advice to you is that you study ahead. Study ahead and make sure you internalize the concepts and keep reminding yourself through repetition. And so what is pharmacognosy? So from the word itself, pharmacognosy can be divided into two Greek words, right? So the two Greek words are pharmakon and gnosis. So pharmakon, direct translation means drug, and then gnosis, the direct translation is knowledge. So in layman terms, we would say pharmacognosy is the study of the knowledge of drugs, right? Or it's having complete knowledge of drugs. But then pharmacology is also about having knowledge of a drug. So what distinguishes pharmacology from pharmacognosy? So this is the difference. So you need to know, in pharmacognosy, we're not focusing mainly on the therapeutic action, on the side effects of the drug, on the dosage of the drug. No. Instead, we're focusing on the sources of drugs from nature. So they can either be of plant or animal origin. And it also studies their use as medicaments from ancient times to present times. That's our definition of pharmacognosy. And so what else is included in the scope? So it also includes the history, meaning how has this particular drug been used in the past days. It also includes the distribution. So the distribution is in which areas is it more commonly found. The cultivation, what's the process of cultivation? Is it sexual? Is it sexually grown? Is it asexual? You know, all those things will be discussed later on. And the collection, you discuss the collection process, the identification, how do you tell it apart from other plants? The preparation, how do you prepare it? The evaluation, also called the standardization, the preservation, the use, and finally, the commerce of that drug. So all these are aspects under pharmacognosy which needs to be dealt with. And so it also deals with the structural, the physical, the chemical, the biochemical, and the sensory character of natural drugs, which are, when we say natural, we mean from plant or from animal origin. And so you need to know that as at present, when we talk about pharmacognosy, we mainly focus on crude drugs, and then we focus on their derivatives, their natural derivatives. Two things, crude drugs and their natural derivatives. What do we mean when we say a crude drug? So a crude drug refers to a drug that has undergone no treatment, no processing. It has only undergone collecting and usually drying, especially if it's of plant origin. It will have undergone collecting and drying. If it was of animal origin, all you've done is you've just collected it. We call that a crude drug, right? And so an example of this relationship would be, so the crude drug example could be the digitalis leaf. So from the digitalis leaf, what would be the natural derivative that you could get? So by natural derivative, I mean the constituent. So what would be the constituent there? You could get digitoxin. So from digitoxin, again, there's a variation of digitoxin called digoxin. So these are constituents. Another crude drug would be the rawophia root. So from the rawophia root, you can get an alkaloid called rezepine. So these are examples of this relationship. And so the next thing I'll discuss are some of the important definitions you need to know when you're talking about pharmacognosy. But before we define the terms, you need to know some of the most important books that we focus on. So the important books we use as reference materials when studying pharmacognosy include: one, we have pharmacopoeia. So a pharmacopoeia is a reference book used in formulation. There are 4 pharmacopoeia that you need to be familiar with. We have 1, the United States Pharmacopoeia; 2, the London Pharmacopoeia; 3, the British Pharmacopoeia; and then 4, we have the Martindale Extra Pharmacopoeia. The next book of importance will be the formularies. So we have 2 formularies that you need to know. So we have the National Formulary, and then we also have the British National Formulary. And then the next books of importance are called pharmaceutical indices. And so the most famous pharmaceutical index is called the British Pharmaceutical Index. And then we also have the Materia Medica. So the Materia Medica is a very important book when it comes to pharmacognosy, originally written by Discoridis. So we'll discuss Discoridis in the next video when we talk about the history. Yeah, I think that's pretty much the books. And so the next thing we'll talk about are some of the definitions so that we do not get lost. So when we say a drug, we'll use the World Health Organization definition of a drug. So what's a drug? A drug is a pharmaceutical product that is intended to modify or explore physiological systems and pathological states for the benefit of the recipient. So what are we trying to say? A drug does two things. It just modifies or explores physiological systems and pathological states. So that will be explained further as we continue going, and especially in pharmacology, I'll explain that further. And then a crude drug, we've said what a crude drug is. It has undergone no treatment, only collecting and sometimes even drying, right? Then an indigenous plant. So an indigenous plant is a plant that is native to that particular region. So an example would be the baobab tree. So the baobab tree, also called Adansonia digitata. I can't believe I remembered that. Also called Adansonia digitata. The baobab tree is indigenous to Africa. And then we also have aconite. It's indigenous to mountainous regions of Europe, right? And then we have naturalized. What do you mean when you say a naturalized plant? A naturalized plant would be a plant that has been grown in a foreign region. So it's not indigenous to that area. It came from a foreign area and then you are growing it there. We call that a naturalized plant. An example would be Datura stramonium. So from Datura stramonium, it's a very important plant. So from Datura stramonium, we get an active alkaloid called atropine. So we'll discuss atropine further in pharmacology. But then what you need to know here is that Datura stramonium was initially native to North America, but is now grown in many areas of the world, including Europe. Next terminology, official drug. So what is an official drug? So an official drug would be a drug that is included in a pharmacopoeia, in a national formulary, or in any other recognized books, right? I discussed some of the recognized books there. And then examples, quite a lot. And then I'll choose a few. Maybe codeine, acetaminophen, quinine. These are examples of official drugs. And then unofficial drugs. So unofficial drugs are drugs that were included in pharmacopoeia, national formularies, and recognized books, but have been removed due to toxicity. So examples will include drugs such as benzoic acid. So benzoic acid is just an acid of benzene, and then it has been found to be carcinogenic. And then for that reason, it's not used therapeutically. Sacrofet. Sacrofet is sometimes used as a protective coating when we have, it's used as a protective coating when you have someone who has peptic ulcers. And so its use has declined, right? And then we also have mercuric compounds. So initially they have diuretic effects, meaning they stimulate urination, right? And so mercuric compounds also seem to have high toxicities, right? And then lastly, we have non-official drugs. So when we talk about non-official drugs, these are drugs that have never, ever been included in pharmacopoeia, national formularies, or officially recognized books. And so these drugs are usually under development. So an example would be curcumine. I've never really seen this drug before. I think I just read about it once. But then an example that I'm familiar with would include drugs like cytodine, for example. Cytodine is an experimental drug that is supposed to work in the same way as Maraviroc. So for those who do not know what Maraviroc is, it's used in the treatment of HIV and AIDS. It's a CCR5 blocker or inhibitor. And so it's the only drug of its kind. And so people or scientists are trying to develop drugs to mimic the action of Maraviroc. And so they came up with prototype drugs like Aplaviroc, Vincriviroc, and Cytodine. These are examples, but they are still undergoing testing, and they are not FDA approved yet. So those are some of the terminologies. Let's discuss some of the applications of pharmacognosy. So what are some of the applications of pharmacognosy? One, pharmacognosy can provide useful drugs that are on their own difficult or impossible to produce by synthetic means. Two, pharmacognosy can provide drugs, right? So these natural drugs are modifiable. So you can modify them in order to increase their efficacy or reduce their toxicity, or just simply copy their structure. And then also, these natural drugs that are extracted by the use of pharmacognosy, they have high utility. And because of their high utility, they can be used as prototypes. An example would be salicylic acid can be changed into aspirin. So what do I mean? When you get salicylic acid, all you need to do is add an acetyl group, and then it becomes acetylsalicylic acid, which is aspirin, right? An analgesic. And then they can provide drugs that are of little or no therapeutic efficacy, but can be modified and the efficacy can be increased. An example is Baccatin 3. So there's this tree. Do I remember the name? The tree is called the Texas brevifolia. Yes, I think I remember the name. The Texas brevifolia. So the Texas brevifolia, commonly called the Pacific yew tree, produces something called Baccatin 3. So this Baccatin 3 can then be changed into Taxol or paclitaxel. This paclitaxel arrests microtubules during the proliferation of cancer cells, and so it can be used in the treatment of cancer. Then what are some of the limitations of pharmacognosy? By limitations of pharmacognosy, I mean limitations of the natural drugs of pharmacognosy. So one of the things you can be able to see is that through pharmacognosy, you can extract these highly active drugs, but they have narrow therapeutic indices. An example is digoxin. Digoxin is used in congestive heart failure. However, it has a very narrow therapeutic index. What do I mean? The effective dose and the toxic dose are so close, and so it needs to be administered by a licensed pharmacist. And then the next thing, so pharmacognosy can we can extract natural drugs that can have therapeutic efficacy, yes, but they can have low potencies. That's another problem we face. So what do I mean by low potency? I mean the amount required to elicit that action, right? So what am I trying to say? When I say a low potency, what I mean is that you need a lot of that drug in order to cure that particular illness. Let me give you an example. Suppose I wanted to cure a flu, right? And then we had this drug. Let me just give it a name. Let me just say drug X, right? So drug X has therapeutic efficacies. Let's say it cures the flu, right? However, let's say you need let me say 300 kgs of drug X in order for you to cure a headache. That's not a good drug. So some of the drugs have therapeutic efficacy, yes, but they have very low potencies. And then another limitation is that for some drugs, the yield is low. Because the yield is low, the production cost is very high. Let me give you an example of paclitaxel. So there's this article in the New York Times I was reading, I think some months ago, where they were talking about paclitaxel. Paclitaxel is a very good drug because it's anti-cancer and it's very helpful. So let me give you an example of, so in the treatment of breast cancer, for example, we give 175 milligrams per square meter of the particular individual, IV, and then we give it for 3 hours every 3 weeks, right? That's how we give paclitaxel. And so it so happens that from one tree, we use the bark, right? So from one tree of the Pacific yew tree, from the Pacific yew, one thing you'll be able to see is that 3,000 kgs of the bark are needed to extract 1 kg of taxol. And so after doing some math, I realized saying, in order to treat one patient, you would need at least 3 to 10 trees of paclitaxel. You would need 3 to 10 trees of the Pacific yew tree. The Pacific yew tree. And then why is that bad? So on average, what am I trying to say? It's 6 trees per person. And then that person has the treatment every 3 weeks. So imagine throughout their entire life, how many trees will you have to cut down? And then imagine saying how many patients are affected with breast cancer. And so one thing you'll be able to see is that there's an ecological cost. You need to cut down a lot of trees, you're causing deforestation, and then one thing you'll be able to, and then there's also a lot of labor involved. And so the yield is quite low. And then this makes the production cost very, very high. And so that's what we're trying to say. And then lastly, usually these drugs, the drugs produced by Pharmacognosy or by natural means, are usually limited by geographic factors, by climate, and by seasons. You can't grow these drugs at any time you want, right? There's usually a specific climate, a specific season, and then specific geographic conditions. And so that will mark the end.